European Perspectives is here today at the European School of Oncology Breast Cancer in Young Women Conference with Professor Anne Partridge, who's both founder and director of the Young Women with Breast Cancer program at the Dana-Farber Cancer Institute in Boston, USA. Professor Partridge, thank you very much for taking the time to talk to us today. For a young woman with breast cancer, receiving a diagnosis must be devastating. How do you help women to adjust both at the physical but also at the emotional level?
So when a young woman is diagnosed with breast cancer, she faces not only the concerns of being diagnosed with a potentially life-threatening disease, but she faces unique concerns, including potential threats to her fertility, to her ability to go to school or work, especially early in a career, or oftentimes she's raising a young family and perhaps doing all three. And so young women also are very, very concerned about beauty and body image and sexuality, all of which can be affected by a breast cancer diagnosis and treatment. And all of these things can work together to have a young woman facing devastating emotional trauma at the diagnosis of a breast cancer. So we work from a comprehensive standpoint to try and get a young woman both optimal medical care, getting at all of those issues, but at the same time to normalize the fact that what she's going through is very, very difficult for anybody, and especially when she's facing all of these points in her life that you don't expect a breast cancer. And so what we try to also do is get her great resources for the emotional and kind of psychosocial issues that she faces.
At this conference here today, we've heard already that young women can get a more aggressive disease. Thankfully, it also sounds like we're seeing improvements in relation to treatment. However, this leads to another potential issue, and that's side effects from the treatment. What are some of the main side effects that we see in young women following treatment for breast cancer?
So young women tend to get, just like older women, multi-discipline therapy, including surgery, oftentimes radiation, as well as most often chemotherapy because they tend to have more aggressive disease as well as more advanced disease at diagnosis. And then the majority of young women also get hormonal therapy. And so their side effects are reflective of all the side effects one can get from each of those modalities. The biggest things we tend to focus on for younger women is the premature menopause side effects, because those are the ones that not only affect them in the early part of their diagnostic and treatment phase, but in long-term follow-up. And that can have tremendous impact on their quality of life for years to come, as well as medical concerns. So we focus on that in terms of trying to get women to tell us about side effects, so that if there's a therapy we can give them to ameliorate those side effects. For example, if telling them how to dress will help them with their hot flashes, or something we can give them to sleep will help them with their night sweats through the night, or something we can tell them about vaginal lubrication if they're having vaginal dryness, which is a very common side effect from premature menopause or even treatment-related amenorrhea, that can make a huge difference in that woman's sexual functioning and therefore her quality of life ultimately.
And as well as the physical ways in which we can help women to cope with these side effects, what are the issues that arise emotionally? And again, how can we support these women in this situation?
So young women have kind of a double whammy because they have all these unique concerns, the fertility, the building of the young family, just starting out in work or school, the body image and sexual functioning issues and premature menopause and the associated concerns. And then on top of that, young women tend to also suffer from a lack of information because there are just fewer of them, and therefore we have less information about them, although that's changing, fortunately. And they also tend to feel isolated because there are fewer of them. And so I think the most important thing is that we try and help young women actually get more information, so do more research, and then get it out there so people and their doctors can be aware of it, and young women can find it on the internet, as well as to try and help young women to get together and support one another. And there are a lot of resources now through national as well as local centers to try and help young women to kind of meet the demands that they face emotionally as they go through things. One other issue with young women that hasn't been that well studied in this setting, but I see it all the time, is that for most young women, as in contrast to older women, this is the first big thing they've ever been through. This is their first major life hurdle. And so their resiliency is not what you see in an older woman who's seen more of what life can bring, which isn't sometimes isn't as pleasant as we'd like.
We've mentioned the area of fertility, which is obviously a very significant issue. How do we preserve fertility while giving young women the optimal breast cancer treatment as well?
So the good news is there are lots of potential methods that may preserve fertility for young women. These range from trying to suppress ovaries through chemotherapy with an LHRH analog. One can also freeze eggs or embryos prior to giving chemotherapy. And then a woman can also potentially get reproductive endocrinology methods after she's been through treatment if she's having infertility. Each of those methods has kind of pros and then cons in terms of the timing, in terms of the potential risk, in terms of the efficacy of the intervention. And unfortunately, most of those methods remain with a lack of clear safety or efficacy data, except in vitro fertilization before, where it's pretty efficacious, not so much safety data. Yeah, safety data in the long run. But that's the one that we tend to say if it's really important to a woman that she preserve her fertility and she has a partner or can get a sperm donor, then that's the one that we say is, used in the general public very frequently, and the rates of pregnancies are quite high.
If we switch to a slightly different issue, obviously living with cancer and cancer survivorship are major issues for these women who are successfully treated. What are the medical, social, and financial issues that face these cancer survivors?
Yeah, so cancer survivorship is a relatively new and growing field, and it's a good problem to have, right? So we've gone from focusing completely on getting people to survivorship, and now we've created a whole generation of men and women, but we'll focus on young women here, who have new problems because they've made it through cancer, but are still living with the aftermath of both the diagnosis and the treatment. And so, these women face a lot of issues. They face, again, premature menopause, associated infertility and symptoms. They face other medical concerns that are related to that, such as bone health concerns, potential long-term cognitive dysfunction, potential cardiac dysfunction in the long-term future. They also face issues related to their emotional rehabilitation and their work rehabilitation. So, for example, if you couldn't work through therapy, you may have lost your job unless you're in a very accommodating employee relationship. And that can be devastating for a woman and her family and her socioeconomic situation. These are all issues that we try not to have happen to a woman and help, work with employers and have laws to protect, but we all know these things are imperfect. The other huge issue for young women is once they get through their first cancer, many young women will remain at risk for a new primary cancer, even independent of having a gene mutation or a BRCA1 or 2 mutation, the known deleterious mutations that predispose to breast cancer. Young women still have a very long time to live with remaining breast tissue. That's not to say young women should go out and all have bilateral mastectomies, because there's no evidence that that's going to help them in the long run, but they're living with a longer time to be at risk for new problems.
Professor, you expanded previously on, or you talked previously about returning to the new normal way of life. What are the key components that you feel can help patients to return to this new normal way of life?
So I think first and foremost, a woman and her providers and her loved ones need to accept that things have changed. And I think until there's kind of an acceptance that you're going to go on in your life, but things are going to be a little bit different. I think many people struggle with the fact that their loved ones in particular want everything to go back to normal. And the young woman who's trying to do that is finding herself in a very different place. And until there's that acceptance, I find it is hard for my patients to move on and accept some of the limitations or the changes, and they're banging their heads against the wall if these are changes or limitations that aren't going to be easily changed. And so that's the first thing to me. And then it's focusing on, okay, what's different and what's tolerable and what can we fix? And a lot of that depends on an individual woman's issues. So one example is, okay, you've had to have a mastectomy. Suboptimal, not exactly what you would have wished for, but you know what? You got breast cancer, you had to deal with it. How can a woman make that easier on herself? And things like getting the right bras, getting the right prosthesis, getting reconstruction, even if you didn't do it right up front, you can do it later, and it's okay to do that. It's, especially for young women, they're going to be living a long time with that. Make good decisions for yourself, assuming you're going to do well, and do well for a long time is what I recommend in the adjustment period.
Okay. You sort of alluded to this earlier in relation to information. Obviously, many young women don't actually realise that they might be at risk of developing breast cancer. How do we get this message across so to help this, or I would say, potentially at-risk population?
Yeah, so that's a very difficult question societally. And I think the most important thing is, again, awareness. And women, young and old, need to be aware that changes in their breasts may be indicative of breast cancer. In young women, most lumps are probably not breast cancer. But I think it is important that a woman be aware of her own breast health, aware of what lumps and bumps she has, and then she can have the capacity to point out any changes or seek medical attention if she's seeing growth of a lump, changes in the skin texture, a lump under the arm, an inverted nipple, bloody discharge from the nipple. These are all potential warning signs for something more concerning than just your average benign breast mass. And so if a woman's aware of that, and her physicians are, they need to be aware that it's probably not breast cancer, but it could be. Young women can and do get breast cancer, and careful attention and workup. And if they're not going to do anything right then, very close follow-up is what's recommended if they're not going to do more evaluation.
Currently, what sort of resources or what support are there out there for young women with breast cancer, both in Europe and in the United States?
So the good news is there's a lot of new and developing resources, both locally at cancer centers and clinics, both in all nations, as well as on the internet. The internet has kind of revolutionized the ability for women and cancer patients in general to get more resources. So, for example, at our center, we've developed a program that focuses on young women with breast cancer. We've published on it, so the nice thing is when people call me and they say, "Oh, I want to hear about what you do in your program," I can now refer them to the reference, and they can say, "Okay, what pieces of these could we develop in our program or complement what we have?" The internet, again, has many groups that are now available and trying to get more young women, to connect with more young women, to give them more resources and help. So there's a group called the Young Survival Coalition, who's in the United States, but they're international. They're based in the United States. There's Belladonna here and internationally, and they have a young survivors group. The Susan G. Komen for the Cure Foundation has a young survivors group. So there's a lot of advocacy groups that are pushing out things for their young patients, which is a great resource because most local centers don't have enough young women, A, and B, the financial resources to do extensive programming for a unique small group.
Professor Partridge, I'd like to thank you for what's been a stimulating interview, addressing both the physical needs but also the emotional needs of young women with breast cancer. Thank you very much indeed.
You're welcome.
Thanks.
Thank you.